Hi there, and welcome to another edition of the Ask Dr. Jack Show. I am of course, your host, Dr. Jack Belitz, chiropractor here in Omaha, Nebraska. Not trying to give you medical advice, just trying to give you great information that you could very easily find on the internet yourself, but providing it so that you can use this information to make important and informed decisions for you and your family. Okay, legal stuff out of the way. Let's talk about the big topic of the day, and that is vaccinations in adults. Now, other than the flu and the shingle shots, really adults don't get that much in the way of immunization ideas and stuff like that, so thank God for that. But let's face it, you know that there's more coming down the pipe here pretty soon. So I came across this really awesome study that it was looking at how to improve vaccines, but what it did was give you some great advice on how to avoid needing them in the future. And so let's get into this. What they found was that people that were suffering from inflammation had really difficult time getting any use out of a vaccine, or basically their immune systems weren't responding to anything. And that's important because, let's face it, the immune system is everything. And so if you can pump up your immune system, you don't necessarily need to have the shingles and the flu vaccinations. So let's talk a little bit about this, what the study was on. It was 78 people over the age of 65 and 97 patients that were under the age of 40. They were all given one of two injections. One that actually contained a benign saline solution, so that was the placebo group, and the other one that actually had an antigen of this V2 virus, which is kind of associated with the shingles, chickenpox. It's all the same thing, type of thing. And they reported that in the test with 18 of the older patients, they were also given a special drug that would decrease the inflammation in their body. Basically what it did was it blocked one of the main pathways for inflammation to occur, which is not something necessarily you want to do, because when there's inflammation in your body has a way of using that to solve a problem. So you don't necessarily want to have this happen just for the heck of it, but what you do want to do is figure out what you can do. Anyway, what it turned out was the people that had the least amount of inflammation had the best chance of not reacting to that V2 antigen type thing. So really awesome things that were going on in that study. So how do we reduce the amount of inflammation? Well, in about a week or two, there's going to be a nice show on different foods that are really great for keeping down the inflammation. So please stay tuned for that. Put it on your calendar. If not, come back a couple weeks from now and look at the old ones. It's going to be there. It's really great stuff. But also, the one thing that does help your body with inflammation is fish oil. Now, fish oil is an amazing product for many different reasons, but one of the main things is that you don't necessarily have to take a supplement. If you are taking 3 to 4 servings of fish a week, you should be fine. But for those of you that aren't, fish oil would be really essential in your body. So please keep in mind that fish oil is not all the same. So getting it at a Walmart or a Costco or a Walgreens, really not a great place to get that stuff, because the fish oil just doesn't work the same. No Name Nutrition, Whole Foods, we have a great product here that I really love. So wherever, just make sure it's a good quality product. If you want help with that, give the office a call, 402-333-4848. I'd love to help you out with that. Anyway, getting that stuff done is going to be really important for having the ability to avoid shingles outbreak in your own body. That's it for this episode of the Ask Dr. Jack Show. I am, of course, your host, Dr. Jack Belitz. I'm loving answering the questions that you ask. So please email us with any questions. Ask Dr. Jack B, that's BEE at gmail.com, or call us up, 402-333-4848, or stop in the office and see us yourself. Have a great, happy, and healthy day, and I can't wait till the next episode, and I can see you then. Have a good one. Bye.